10 to 7, nearly 4 months. That's how long some veterans have to wait to get an eye exam at the VA clinic in Milwaukee.
Because of COVID, vets are seeing average wait times for specialty doctors climb. As the I-Team's Kristen Byrne shares, switching to televisits could help, but veterans need to be on board.
At the start of the pandemic, thousands of in-person visits at VA clinics in Wisconsin were canceled. That created a big backlog, which has hardly budged. Months into this health crisis, and the men and women who served our country are finding it difficult to make appointments for elective surgeries and other specialists like optometrists, cardiologists, or dermatologists.
We're working as quickly as we can. We're prioritizing the visits.
That's Chief of Staff at Milwaukee VA Medical Center, Dr. Michael Erdman. He's sitting next to Dr. Mary Ellis, who heads telehealth visits with the VA.
We can use their existing equipment and just teach them how to download the app and then conduct the visit.
Video visits aren't the issue. The I-Team checked wait times for in-person new patient appointments just last week at the Milwaukee VA Medical Center. Cardiology was a little over a month. Optometry, about 4 months. Is that an acceptable time?
Trying to always improve on that, and that's part of making up for that backlog. Our goal is to have them all under 30 days is our goal.
So 127 days, that's way away from 30 days, though.
It is.
Dr. Erdman says this has nothing to do with staffing shortages. Instead, VA clinics can't be running at the capacity they were before. And as COVID cases surge in Wisconsin, he says some veterans just don't want to go in.
We've heard that from many of our patients that they're still quite frightened of coming into our healthcare setting because they're afraid they might get COVID.
Open the email from telehealth scheduling system.
Turning to telehealth seems like the logical solution, but VA data shows it isn't as popular with the veterans as one might think.
Only about 10% of our veterans currently are enrolled in the virtual program that we have, which is called VBC, VA Video Connect.
Dr. Ellis wants veterans to know all they need to do is ask their primary care doctor at the VA about video visits. If a person isn't tech savvy, there's help available.
We have an entire department called telehealth, and they are the ones that will conduct practice sessions with the veterans so that they become comfortable using the technology.
How long do you think it'll take before your offices will be back to normal with regular wait times? Do you have a guess at all, an estimate?
Until we get the pandemic under control, I don't think we'd ever be back to normal wait times.
There's one really important thing to note here. If you are a veteran with an urgent medical need, and that includes a mental health issue, Dr. Erdman says the VA will get you in right away. I'm consumer investigator Kristen Byrne.